there is a high-protein diet which can be effective in combating headaches, especially during summer? Dr. Francesco Francini, a physician-nutritionist at a hospital in Padua, emphasizes the importance of this specialized diet in alleviating this condition. By seeking expert guidance and adopting this approach, we can effectively overcome the challenges posed by headaches. What is the relationship between headaches and food?
Over the past few years, we have formed a partnership with the neurology clinic to establish a dedicated outpatient clinic centered around the treatment of migraines. The reason behind this collaboration stems from recent evidence that supports the efficacy of the ketogenic diet in both curing and managing migraines. Throughout our accumulated experience, we have extensively verified the extraordinary potential of the ketogenic diet. Subsequently, I personally undertook research on this subject matter, with my primary objective being to provide patients with a comprehensive understanding. Additionally, my intention was to equip healthcare professionals involved in migraine treatment with a valuable tool that explains the intricate relationship between nutrition and headache, specifically emphasizing nutrition's impact on migraines. The distinctive nature of migraines as a form of headache establishes significant associations with nutrition, encompassing both causal links, indicating that nutrition has the ability to trigger attacks. Moreover, as mentioned previously, there are potential therapeutic applications for nutrition in managing migraines.
What is the ketogenic diet?
The ketogenic diet is a diet that develops a condition of ketosis in the body. That is, it causes the liver to produce substances that are then used by the central nervous system in the brain for energy purposes. It has been seen that these substances, however, have a whole range of activities that are not energy nutritional. For example, they have anti-inflammatory activities, and this can be beneficial for various diseases. In order to be able to create this condition, that is a state of ketosis, one must reduce carbohydrates a great deal, precisely because the liver produces these substances, ketone bodies, to make up for the lack of sugar, the lack of glucose, which is the primary energy source of the nervous system. To successfully follow the diet, one must avoid several food items such as bread, pasta, cookies, polenta, potatoes, and crackers. This requires a focus on consuming high-fat and protein-rich foods. When on a ketogenic diet, even the consumption of fruits and fruit juices should be limited to some extent, despite cravings. Following these guidelines is not an easy task, but it is necessary to attain the desired results.
Is it a diet that helps to lose weight?
Let's say that the ketogenic diet commercially is used and is exploited to promote weight loss, and it is a diet that, even without specifically wanting to limit calories, precisely because one of the effects of ketone bodies is to reduce appetite, spontaneously the person eats well and therefore tends to lose weight, even if he or she does not want to lose weight. This occurrence may not happen every time, but it is prevalent in most situations. In our experience, we have observed that some patients on a ketogenic diet do not experience weight loss. In fact, a few individuals may even gain a small amount of weight. However, typically there is a noticeable reduction in weight. Moreover, if a person intentionally restricts their calorie intake for weight loss purposes, we have seen very significant results in terms of weight reduction as well. It is worth noting that weight plays a role in the severity of migraines, as it affects the frequency and intensity of attacks, and losing weight generally brings about some positive effects in this regard.
Does this diet have colorectal effects?
The ketogenic diet may have some side effects, primarily noticed in the initial stages, usually within the first week or 10 days. This period can be rather uncomfortable, as individuals may experience lethargy due to the absence of carbohydrates. This state of weariness is commonly referred to as keto flu by the Anglo-Saxons, which is the combination of keto for the ketogenic diet and flu to indicate flu-like symptoms caused by the diet. Apart from the possibility of having a fever, people who are going through keto flu may also encounter flu-like symptoms such as severe weakness, occasional nausea, and sometimes a headache that feels like a pulsating sensation in the head. Interestingly, this headache is ironic, as a diet that causes a headache is often employed in the treatment of migraines. However, it's important to note that this headache is generally mild, similar to the dull discomfort experienced after a night of indulgence. After a few days, these symptoms tend to diminish, and with perseverance, individuals can experience an overall improvement in well-being. It has been observed that intellectual performance often experiences a boost, leading to enhanced mental efficiency and increased resistance to fatigue. It is generally necessary to pay the price of the initial week. At a metabolic level, it has the potential to elevate levels of uric acid, but on the contrary, it can also lower blood pressure. Therefore, it is a diet that could possibly benefit those undergoing hypertension treatment. However, if an individual already has low blood pressure, particularly during the summer when the heat causes a drop in pressure, this could present an additional issue that should be monitored by a competent doctor. Typically, the ketogenic diet is approached in a do-it-yourself manner, although this approach does come with certain risks.
Does it cater to a diet where various easily accessible foods are permissible?
In fact, there is absolutely no need to rely on costly industrial foods for a satisfying meal. We strongly believe that any main course could essentially be consumed, whether it is meat of any kind, fish of any variety, eggs, or even cheese. The options are extensive. Alternatively, if you wish, a vegan ketogenic diet can also be followed, as there exists an array of soy products, tofu, and mushrooms, all exemplifying a vast range of vegan food options free from animal-derived ingredients. Additionally, for those who are vegetarian and not vegan, one can easily thrive on a wide selection of products, including milk, cheese, and eggs, while eliminating meat from their diet. The possibilities are plentiful when it comes to maintaining a varied and satiating vegetarian lifestyle. To make the diet more varied, one can include fats like oils, butter, and mayonnaise. Adding a touch of imagination can prevent monotony. The internet is now filled with ketogenic cookbooks, offering a wide range of dishes that can satisfy cravings and taste preferences. This way, one can enjoy delicious meals without sacrificing health goals.
Ice cream and fruit should be taken out in summer.
There are multiple options when it comes to sugar-free ice cream recipes, especially for those who follow a ketogenic diet. These recipes often recommend replacing sugar with non-carbohydrate sweeteners such as erythritol. Erythritol, which has similar physical characteristics to sugar, allows for the creation of delicious ice creams without the need for traditional sugar. It is interesting to note that even local ice cream parlors now offer sugar-free alternatives, indicating the growing popularity of these options. Additionally, individuals can easily make homemade ice cream recipes that closely resemble conventional ones while being free of sugar.
Is it a diet that can be sustained for a long time?
These diets were originally created in the early 1900s as a remedy for epilepsy. Nonetheless, with the advent of epilepsy medications, they fell out of favor. As of late, in the 1970s, they have experienced a resurgence as a treatment option for children who suffer from drug-resistant epilepsy. Currently, these diets are primarily employed in children with an unfortunate condition that does not respond well to epilepsy medications. These children adhere to the diets for many years and still manage to mature and lead normal lives. Considering a child can follow them for extended periods, it is even more possible for an adult to do the same. Of course, it necessitates meticulous monitoring of various parameters and the guidance of a knowledgeable and competent professional.
Should our diet be modified during the summer months when compared to the winter season?
No, because in the summer, when the surrounding temperature is higher, The difference between our body temperature and the outside temperature is reduced, even when the outside temperature is 36 degrees. There is hardly any distinction. It is our duty to maintain our body temperature around 36 to 37 degrees, which requires a significant amount of energy just to compensate for the disparity between the outside temperature and our body temperature. Therefore, if it is 0 degrees outside, we have to exert effort to reach a 36-degree temperature, whereas if it is already 35 degrees outside, the effort required is minimal. During the summer, our calorie intake decreases as we require less energy. However, sweating increases significantly, which necessitates a shift in our diet. We need to consume foods with less energy but a high amount of fluids. This becomes even more crucial for individuals with specific health conditions such as diabetics with kidney failure or those with coagulation problems. Dehydration can lead to severe complications for these patients and must be avoided at all costs.
What advice do you give to a person who realizes they are suffering from migraine?
There is so much to discover in your history, specifically in the realm of food. It pertains to the study of food and its impact on health. For instance, there may be a correlation between consuming certain foods and experiencing seizures. Some examples include wines, both red and white varieties, particular cheeses, bananas, chocolate, and foods containing gluten. These are all types of food additives, such as glutamate. Additionally, substances like coffee can also act as triggers. These trigger foods can unleash the negative energy associated with a migraine crisis. By examining a patient's medical history, we can determine if there is a connection between these trigger foods and their onset of migraines. Another important factor to consider is one's behaviors, not just the specific types of food consumed. Fasting, for instance, has been linked to the development of migraines, as has excessive eating. Additionally, consuming alcohol after a large meal, regardless of whether it is wine or another type of alcohol, can potentially lead to alcohol abuse. It is evident that one trigger can result from another, as I previously mentioned regarding fasting or overeating.
Advice for the summer?
The advice for the summer season is pretty generic except for those who suffer from migraines. However, it is important for normal individuals to prioritize their hydration. This is a recommendation that we frequently hear, often brushing it off as the same old story every year. However, this mindset is misguided because we tend to neglect the possibility of not feeling thirsty. We must consider that certain groups, such as the elderly, may have a diminished sense of thirst. As a result, they might be dehydrated without experiencing the sensation of thirst. This is particularly worrisome as dehydration significantly increases health risks, especially for those who already have medical conditions. For instance, individuals with diabetes are prone to developing hyperglycemic comas when dehydrated. Similarly, those with kidney failure experience worsened kidney functionality when dehydrated. Dehydration can also cause the blood to become more viscous, leading to an increased risk of thrombotic diseases. Therefore, individuals with such health issues need to be cautious about staying hydrated, even if they do not feel thirst. It is crucial to maintain regular diuresis, ensuring a consistent production of urine, just like in winter. Consequently, we should be wary of any sign indicating a reduced amount of urine and very dark color, as it signifies concentrated urine and the need for additional fluids. It is advisable to replenish lost fluids through sweating with water and avoid consuming high-calorie beverages such as fruit juices or sweetened tea. These drinks not only provide hydration but also unnecessary caloric intake.
Mineral salts, are they necessary or not?
Mineral salts are necessary only when dealing with excessive sweating conditions. Under such circumstances, an increased intake of sodium or salt is required. Individuals who experience extreme heat may also suffer from muscle cramps. Even when all the regular mineral levels in the blood are normal, It has been observed that magnesium supplementation can help reduce the occurrence of cramps. This is because magnesium has a relaxing effect on the muscles. Additionally, supplementing with magnesium and potassium can prove beneficial even if the blood levels of these minerals are within the normal range. However, there are certain conditions such as renal insufficiency where supplementing with these salts can be risky. In such cases, the kidney is unable to eliminate the excess minerals. Therefore, if we are in good health and do not have any underlying health issues, we can use these supplements responsibly. However, if there are any doubts, it is advisable to consult a medical professional to determine whether these supplements will be helpful or harmful.